Good day, ma'am. I am here to do the vital signs demonstration. First is you need to do the hand washing or sanitize your hand using an alcohol to prevent cross-contamination. Grade the client, introduce yourself, and verify the client's identity. Hello, good day, sir. I am Hazel, and I will be your student nurse today. Are you Mr. Buag?
Yes, ma'am.
Okay, thank you. Expose the patient axilla by securely folding the client's shirt sleeve or gown up to the deltoid region. If axilla is moist, dry it with patient's towel in a patting motion. Remove thermometer from the container. With the cotton ball, wipe the thermometer in a rotating motion from the sensor to the neck. Place the thermometer in patient axilla. Assist the patient to place the arm tightly across the abdomen to keep thermometer in place. Wait until the thermometer will buzz.
Amega. Jerry.
Judy, kasih na ako. Dapat, nagkasuli na. Good friend. Judy, nagkasuli na.
If the thermometer will buzz, note the result of the temperature. Assessing peripheral pulse. First, assist the client to a comfortable supine position or to a sitting position on a chair or at the edge of the bed. Select the pulse site point. Normally, the radial pulse is taken. Place the 2 or 3 finger tips lightly and squarely over the pulse point. Never use the thumb in assessing pulse. Rest the arm in a 90-degree angle across abdomen with palm facing downward. Observe the first minute, the regulatory of the pulse count for 1 full minute. Take pulse for 30 seconds.
mama.
Note the pulse rhythm and volume. Assessing the respiratory, feel the rise and fall of the diaphragm while supposedly taking the radial pulse. Count the resting rate in 60 seconds. One exhalation and one inhalation are counted as one cycle. When abnormal breathing pattern is noted, use the next 60 seconds to carefully observe the characteristic of the client's respiration. Note the rate, deep rhythm, and character of respiration. Refer any abnormal findings or any complaints of the client. Assessing blood pressure. Position the client appropriately and allow 10 to 15 minute rest if the patient is engaged in a strenuous activity before BP assessment. In a sitting position with arms slightly flexed, the forearm supported at the heart level and facing up. Fold the patient's shirt, sleeves, or gown up to the shoulder, making it sure it is secured and will not fall to the brachial area. Ask the client not to speak when BP is being measured. Smoothly and evenly apply the cuff with its lower border located about 2.5 cm above the antecubital space. Ensure the tube is placed in line within the brachial artery. Measure if the cuff is snugly fitted by inserting your 2 fingers into the BP cuff. Position oneself so that the manometer is vertically at the eye level. Observation should not be farther than 1 meter. Insert the earpiece of the stethoscope in your ear so that they tilt slightly forward. Be sure sounds are clear, not muffled. Ensure that stethoscope hangs freely and is not contact with any object. Warm the diaphragm of the stethoscope. Locate the brachial artery and place the diaphragm of the stethoscope over the brachial pulse. Secure the chest piece by placing over palm of the non-dominant hand over it. Close the valve of the pressure valve clockwise until it is tight. Quickly inflate cuff until the last sound. Slowly release open the pressure valve and allow the manometer gauge to fall at a rate of 2 to 3 mmHg per second. Note the point on manometer with the first clear sound is heard. The sound will slowly increase in intensity. Continue to deflate the cuff, noting the patience at which a sound disappears. Listen for 10 to 20 mmH after the last sound. Then allow remaining air to escape quickly. Remove the cuff from the client's arm and assist patient to assume a comfortable position. Cover the upper arm if it was previously clotted. Discuss the findings to the client and do health teaching as needed. And wash hands. And last is do the documentation. Chart in TPRBP sheet according to the hospital policy. Report of normal findings of vital signs. Report any alteration, observable signs, and symptoms of the patients and the patient's reactions.